welcome to Olsem Wanem. We have covered a number of health issues this year, from child maternal mortality, cancer to eye care, and mental health in the country. In this episode, we look back on some of these challenges, including lifestyle diseases and measles. And along with that, we feature the 22nd Health Conference that was held recently in Port Moresby.
Like most of the rural villages in the Morobe province, Lembati is remote and isolated. It is situated in the hinterlands along the Sarawak Range in the Finsafen district. The nearest government station is in Pindu. It is a 3-day walk from Lembati village. At Lembati, infant and maternal mortality remains a big concern. At least 6 mothers die every month from childbirth complications and other preventable diseases. A team of eye specialists visited remote villages in the Garaina Valley in the district. They came to assess and diagnose people with visionary problem.
Since me been work one time all NGOs na kam lo look do me. This lakan service ino bin sa kamap lo rural areas. All NGOs actually this service go lo certain all places where only got funding.
Bulolo districts. When the contractors began constructing the current building 9 years ago, nurse Filma Gadebo raised concerns that the specifications of this building were wrong. Today, the unit doesn't admit patients here because it's too dangerous for the staff and other patients.
And the cell is here. So let my patients in there, so that is the cell. And this is for the recovery part of the ward. It's so close. If these people are recovering and patient in there shouting and screaming, you one coming in locked in the cell, these people are going to all start shouting and screaming, and then they are down again, and like we have to start all over again to take care of them. And the building itself, it's not, it's not suitable and it's not properly made for a psychiatric patient to be taken care of. Because patient who is coming hallucinating, shouting, screaming, and angry, the moment they enter the psychiatric ward, their freedom is taken away. As we take them in and then we're going to lock them up and then treat them. When they get settled, then we take them out. But I don't have the proper ward here to take care of the patients, because the ceiling is too low, that the lights are low, and they can get electrocuted because they're going to stand and rip the place down. We have lowers here, glass lowers, and it's not safe. They can just break this and get out. The toilet and shower at the back, there is open screen. Like no bars. It's not supposed to be like this.
But this is just part of a nationwide problem.
We also take a look at the labor ward situation at the Port Moresby General Hospital. Over a phone interview, sister in charge of labor ward, Alice Barab, said 51 babies are delivered each day on average. Previously, they delivered 41 babies a day. Meanwhile, the whole labor ward itself has only 30 nurses who work on 3 shifts. Not only that, but to make matters worse, the labor ward has a total of 36 beds with an average of 51 babies a day, and 16 women will have to wait for a bed to be given to them. The PNG government is constantly faced with pressing development issues, not only in the health sector, but in all other areas as well. This year, the national government budget was set at 15 billion kina, a 13.8% increase over the 2013 budget, and it was another deficit budget. Education was allocated 1.5 billion kina, health 1.3 billion kina, law and order 1.3 billion kina, agriculture and small businesses 777 million kina, and we started off 2014 with not only the free education policy but also the free health policy. For urban areas, we now live in a faster pace of life where everything is expected to be readily and easily available. Processed fast food has become quite common in many areas, not only in restaurants, but also on the streets. It's either chips or chicken or the lamb flaps market. Here is a story of a lamb flaps market that has become quite successful in the past 2 years. Rush hour, traffic jam, overcrowding, Port Moresby City has moved into a faster pace of life where almost everything is expected to be readily and easily available, and that includes food. Jenny and Mac have been selling lamb flaps, sausages, banana, and cacao or sweet potato for the past 2 years now. These chopped up lamb flaps will be sold for 1 kina apiece.
Misa by midlo 270 kina. Okay. 1000 misa gugin okay. Profit number them some time is sim 250 profit 150 or 180 on this line.
From selling lamb flaps and sausages, they have raised over 25,000 kina in the past 2 years and have expanded their business. They now have a small taka shop, which they have recently connected electricity to it and will be soon open for business.
Now, total 8,000 we will spend, 25,000 we will spend the finish. Lo cooking meat na wagons la ili taka box le.
We also caught up with one of Jenny and Mac's customer who tells us he stops by at least every day to buy lamb flaps from them.
I'm so fry meat so meat blame when blood testing me more good la narbla so kum so blasa kam buy meat lang.
Jenny and Mac tell us that they get over 70 customers a day. The peak hours are usually in the morning and in the afternoon.
Busy lo work na samdal sa busy lo school work lol. Then all nogat work also nogat time lo cook na kike laos o sa kambam liya na kako na puta do na bo sa bam liya o sa kariko laos. Na also na sa company si midlo lo mi arab na ila sa puli customer na sim good la profit number.
With their recent taka shop, one can imagine that fast food such as these are also on very high demand. But then there are also other popular food outlets in and around the city. Well, bottom line is, as the saying goes, you are what you eat. According to the World Health Organization, imported processed foods have so far dominated our diets. As a result, Papua New Guineans have become more and more exposed to non-communicable diseases, or NCD for short, also known as lifestyle diseases. These are diseases that are non-infectious and non-transmissible among people.
All the deaths in 2008 were collected by Clement Mala, the former health secretary, and I. And this is what it shows. On the left side, we still have pneumonia, TB, malaria, meningitis. But on the right side, you are seeing heart disease, stroke, diabetes coming up. That picture was non-existent in the 60s, in the 70s and the 80s. Now, it's a big thing. This is the internal medicine audit from January until now. Nearly 800 admissions. Out of those 800 admissions, communicable diseases are 63%. But look at the non-communicable diseases, from less than 1% to now 26%.
Papua New Guinea has also been ranked the 5th highest smoking nation in the world, with 51.4% of the population classed as smokers. The highest is East Timor, followed by Indonesia, Kiribati, and Armenia. We caught up with Kanage, who sells cigarettes for a living. He tells us that he sells over 400 cigarettes a day.
Misa selling blue cigarette also. Now, Mr. Fitting for family, blow lo lose cigarette, Mr. Salem 2 pla, ina lo 1 pla day, na display, lose cigarette in up long 400 cigarette, stop in chat. Mr. Salem Olsem, Mr. Stop.
Eating too much processed foods, abuse of alcohol, and smoking can have very harmful effects.
We need to be encouraging people to be growing vegetables, eating vegetables and nuts and all of those. Sporting bodies hasn't quite worked. We've failed. And I'm part of that failure. I'm a very busy educator and a clinician at the hospital at the Cerebral. We need somebody to actually take the whole thing by the neck and say, let's move on. So we failed. Cardiovascular disease in the young is a very important part of our life. We see many of our children who are obese, who are on television, sitting down watching television all the time. They've got little gadgets, mobile phones, social media, whatever. And you look back at the time when we were in primary school, there was a game called Peggy Peggy. And with Peggy Peggy, everybody was very slim. Now look at all the children around the place. There's no more Peggy Peggy. It's television.
Another health issue this year is measles. The first measles case was reported in February this year, and now confirmed cases have gone over 650. We now take a look at its symptoms and ways of prevention, as well as responses from the recent 22nd Health Conference. Measles is a leading cause of childhood morbidity and mortality, accounting for nearly half of the global burden of vaccine-preventable deaths. This is according to Health Secretary Pascal Kase. Measles is an acute onset of fever and rash with cough, running nose, and red eye. The first measles case was reported in February this year. Since then, there has been an increase in confirmed cases to over 660. Measles begins with a high fever, malaise, cough, and running nose, and it is highly contagious. The virus can be spread through coughing, sneezing, or when one is in close contact with infected nasal and throat secretions of an infected person. Complications associated with measles also include pneumonia, otitis media, diarrhea, and croup. Majority of the measles cases occur among non-immunized children.
Had a confirmed case, and then we referred them to PMGH, and then PMGH confirmed that it was measles outbreak, and it was a children, not a babies, but it was children age of 9. So when we confirmed that, doctors confirmed, and then they told us the team must urgently go out and start giving vaccinate all the children age of 6 months up to age of 19 and 20. So the team started going out, even though we were skeleton roster, but we still try to make ourselves available to go out to give immunization, measles vaccines to children.
Measles can be prevented through immunization as well as good nutrition, including green and yellow vegetables and fruits. Since its first reported case in February in Port Moresby, other provinces are now facing the same issue.
You have to have enough people to do it because they're
in May this year, NCDC had 454 cases, East New Britain 36, Southern Highlands Province 30, Western Province 18, Central Province 7, East Sepik 5, Sundown 4, New Island Province 2, Enga and Hela both with 1 case. The measles outbreak in the country was also highlighted during the 22nd Health Conference held recently in Port Moresby.
Let me talk here about the measles outbreak that is now affecting the country. This is a result of us not doing immunization well. This is a result of us relying on SIA. SIA, when introduced, had a purpose, but we became complacent, thinking that when SIA resources came, time came, we would increase our immunization coverage. It didn't work. That is why we have this problem right now in this country. So, back to basics, back to routine activities that we've been doing. This must be emphasized. However, having said that, there are other areas where the basic interventions will not apply, and innovative interventions will need to be introduced. Example, we want to introduce an integrated disease surveillance and response system in public health. This will replace the vertical approach that we use now, program-based vertical approach.
Health services in the country have always been criticized, despite the fact that there are many contributing factors. During the 22nd biannual health conference held last week, health professionals came together to relook at what has been done and what needs to be done.
Government efforts in terms of planning for allocating resources, mobilizing resources for the public health sector, population-based response to the healthcare needs in this country has lagged behind facility-based healthcare over the last 39 years since independence in this country. I say that without embarrassment, because I'm convinced that until recently, when we had outbreaks of exotic communicable diseases, we have not actually done that. When H1N1, SARS, cholera, recently chikungunya, and even now measles, then we begin to think about how important public health is in response to this type of situations.
The health priorities of the government are free primary health care, health infrastructure and rehabilitation and development, medical supplies reform, health workforce plan, provincial health authorities rollout, church health services, and improved governance.
All departments were given to identify 3 critical areas. But health is more than that. That is why we identified 7, not 3, but 7. I am pleased to report with confidence that the health sector is progressing all of these priority areas. To date, the free primary health care and subsidized specialist services is being implemented in the country. Major health infrastructure development projects are underway as I speak. A strategy to enhance the health sector workforce has been recently endorsed by Cabinet for its implementation. For the first time, the government of Papua New Guinea has done a mass procurement of 100% medical supply kits for distribution throughout the country. 9 provinces are at different stages of implementing the Provincial Health Authority Act 2007. And the results are promising. Many provinces are now expressing their interest to join.
With the key priorities from the government, health professionals will now closely work together to look at the health issues. They were also encouraged to perform to see positive changes. The goal of the health plan is to see the need to concentrate on improving primary health care for the rural majority.
The O'Neill Dion government made a commitment when it took office in 2012 that we must improve service delivery to especially the majority that lives in our rural communities in this country. And we owe it to our people to make sure that all levels of the service delivery system are not only responsive, but are effective and efficient in driving the political intent of this government.
The conference also allowed feedbacks on issues in regards to health with the take-home message, health is everyone's business.
We struggle with our laboratory staff, and the training we give is about culture of quality. The medical school produces all these workers, but it's how you nurture them at your own hospitals and health facilities. Salaries are concerned, accommodation. They are factors that lead to their performance.
I would like to say that what we are doing now is so far so good. What we need to do now, concentrate more on, is the quality.
The CHW schools have doubled their intake, but I'm afraid of the positions that are available.
And that's all for this episode. Thank you to all who have participated, and if you have any comments or stories you would like to share, please contact us via the address on your screen or visit us on our Facebook page. And make sure to join us next week as we feature illegal fishing in Manus Province. For now, enjoy the rest of your viewing on your #1 station, MTV.